Understanding estrogen deficiency and menopause. What every woman needs to know: menopause, which typically occurs around the age of 51, marks a significant transition in a woman's life. The quality of life for many women during this time can be severely impacted by a multitude of symptoms caused by estrogen deficiency. Unfortunately, many women are unaware that these various symptoms are interconnected, and they often visit multiple doctors thinking they are dealing with separate conditions. However, all of these symptoms stem from a single cause: estrogen deficiency. The complex symptoms of estrogen deficiency. Estrogen is a crucial hormone for women, regulating a range of physiological processes. As women approach menopause, their body's production of estrogen decreases, triggering a cascade of symptoms that affect not only physical health but emotional and mental well-being as well. These symptoms can include hot flashes, night sweats, anxiety, mood swings, irritability, depression, joint pain, hair loss, dry skin, urinary incontinence, weight gain, loss of sex drive, and more. What many women don't realize is that all of these symptoms are interrelated. It's not that a woman is facing 15 separate issues, but rather that she is dealing with one condition: estrogen deficiency. This is analogous to thyroid hormone deficiency, where a lack of thyroid hormones can lead to symptoms like dry skin, weight gain, fatigue, and other issues. Hormones function as a system, and when one is out of balance, the entire system is affected. The role of estrogen: a fountain of youth. One of the key points often overlooked in the discussion of menopause is the vital role estrogen plays in maintaining the health of the heart, bones, and brain. Estrogen is often referred to as a fountain of youth because it helps to maintain the youthful elasticity of arteries, the density of bones, and the function of the brain. Without it, women experience what can be considered the aging process accelerated in these three critical areas. For instance, as estrogen levels decline, arteries lose their flexibility and become stiffer. This is the beginning of what is known as hardening of the arteries, which can lead to an increased risk of heart disease. Similarly, the loss of estrogen contributes to osteoporosis, as bones become less dense and more susceptible to fractures. The brain is not immune to estrogen's effects either. Declining estrogen levels can lead to cognitive decline, and in some cases, conditions such as Alzheimer's disease. Hormone replacement therapy, HRT, controversy and misconceptions. The topic of hormone replacement therapy, HRT, has been highly controversial, largely due to the findings of the Women's Health Initiative (WHI) study. This study led to widespread fear about the risks of HRT, with many believing that it could increase the risk of cancer and heart disease. However, a closer look at the study reveals several critical flaws. The WHI study focused primarily on older women with an average age of 63, long after they had already gone through menopause and lost significant amounts of estrogen. The study aimed to determine whether HRT could prevent heart attacks, but by the time these women were given hormone therapy, they had already experienced the aging processes in their hearts, arteries, bones, and brains. In essence, they were already at risk for diseases like heart disease and Alzheimer's. Therefore, it is misleading to conclude that HRT causes these diseases based on this study. An analogy often used to explain this is comparing it to insulin-dependent diabetes. If a diabetic continues to have health problems like blindness or kidney failure despite using insulin, we wouldn't blame the insulin. Similarly, when women who have already experienced estrogen loss develop age-related diseases after starting HRT, it doesn't mean the hormone therapy caused the diseases. It simply couldn't reverse the damage already done. Tailoring treatment to the individual. One of the biggest mistakes in treating menopause is using a one-size-fits-all approach. Women are not robots, and their hormone therapy should be tailored to their specific needs. The key is to find what works for each individual woman. For some, the use of synthetic hormones may be ideal, while others may thrive with plant-based options. What matters most is how the body responds to the hormone, not whether it is synthetic or natural. Furthermore, when it comes to diet, some women believe that following a plant-based diet can prevent the effects of estrogen loss. While a plant-based diet is excellent for heart health and can help reduce the risk of conditions like heart attacks, it cannot replace estrogen's role in the body. Hormones like estrogen are irreplaceable by food and exercise. A plant-based diet may support overall health, but it will not restore the hormone levels necessary for proper function. The importance of hormone replacement. The bottom line is that hormone replacement therapy is not a magic cure, but it can be an essential tool for managing the symptoms of menopause and protecting against the long-term health risks associated with estrogen deficiency. Without estrogen, women may face an increased risk of heart disease, osteoporosis, and cognitive decline. It's important to remember that every woman's body is unique. While hormone therapy is a personal decision, understanding the benefits and risks along with the scientific evidence is crucial. Women should work closely with healthcare providers who understand the intricacies of menopause and who can tailor treatments to their individual needs. Conclusion: a personalized approach to menopause. Management menopause is a complex and transformative period in a woman's life. The symptoms of estrogen deficiency can affect many aspects of life, but with the right treatment, many women can regain their vitality and maintain their health. Hormone replacement therapy, when used appropriately and tailored to the individual, can play a significant role in managing these symptoms and preventing long-term health risks. It is essential for women to understand their options and make informed decisions based on their unique health profiles and lifestyle. In the end, the key to navigating menopause successfully is to avoid one-size-fits-all solutions, and instead focus on personalized care that addresses the specific needs of each woman. With proper guidance and treatment, women can not only manage menopause symptoms but also improve their overall quality of life as they age.